My name is Crystal Waller, and I'm the Health Services Director at St. Norbert College. Today I'm going to be talking about the services provided at the clinic, how to make an appointment, some of the COVID adaptations for direct care, the 3 health requirements for all incoming freshmen, and how to stay healthy this academic year. First of all, our location. We're located on the second floor of the Mulva Family Fitness and Sports Center. We're open Monday through Friday from 8 until 4:30, and we do have after-hours nurse-on-call support through Bellin Health. All of that contact information for after-hours support is available on our website. We do have support staff here at the clinic as well as licensed medical staff. We have a health educator who manages a Department of Justice grant as well. We do also provide physician's assistant, advanced provider services, nurse practitioner service, again considered an advanced provider. And we also have a psychiatrist that comes to campus monthly. And if that service is needed, that is coordinated through one of our nurses and counselors. We do have massage therapy services monthly. We do contract with a licensed massage therapist, Eric Peters. He's pictured here on this slide. And again, all by appointment. So every student pays a health fee. That health fee covers unlimited nursing consultation, basic screening tests, over-the-counter supplies, access to the fitness center, and counseling service. Again, counseling service is a separate department. However, they are located on the same floor as us at the back of the building, and we do coordinate and collaborate very closely with our counselors. There is a fee for service if a student is needing to see an advanced provider or the psychiatrist, and the fees are listed there. Those fees would not be incurred unless the student gives consent and agrees to see the advanced provider or psychiatrist. So again, that is a conversation with the patient, the student, as well as, many times with the parents on the phone as well. So that is not an immediate incurred charge. That is definitely discussed and consented to ahead of time. We also provide immunizations for an additional fee for service. We provide the flu vaccination, hepatitis A, hepatitis B, tetanus, measles, mumps, rubella for those who need it. Many students, domestic students anyway, many of them have the MMR as part of their childhood vaccination series already completed. We have some basic prescriptions on our shelf. Again, it's the amoxicillin, the Z-Pak, Cipro. We have some basic antibiotic prescriptions here on campus, but for those prescriptions that can't be serviced on campus, we do have the CVS pharmacy and Walgreens within walking distance of campus. So those are the 2 pharmacies that are the closest, again, within a mile or 2. Advanced lab testing, we do through our advanced providers. They do and sometimes order lab testing, and we contract through Bellin Health again to do our lab analyzing and our courier. So that is a possibility if that is a need for your student. We have slings and splints and crutches and wheelchairs available. Hopefully not needed, but all of that durable medical equipment is available and no additional charge unless it's not returned to our clinic. We do have massage therapy, as mentioned previously, $25 for a half hour and $45 for a 1-hour session. Again, very inexpensive compared to what you would pay for massage therapy in the community. So appointments. How to make an appointment. It's important that this year especially, no walk-ins are being taken. Always call the clinic to make an appointment. We have to go through a very intense and thorough triage protocol to assure that we are only seeing well students in our clinic. And we'll talk a little bit about COVID testing and how that's going to work on campus in the slides to come. but it's very important that people just do not present at the clinic, but instead call ahead and discuss what the need is to make an appointment to be seen at the clinic. You can also email, but always the best case is just to call and have that conversation with our support staff to get that scheduled. Always remember, don't skip a class for an appointment. Like if you needed to come in for a physical, let's say, please don't schedule it during your biology test or your biology class. You want to schedule your medical appointments around your other commitments, and class is very important. So we don't want you to skip class for an appointment. Notes are not written for missed classes, so again, it's very important that you don't skip class for a medical appointment. So again, delivering direct healthcare service during COVID. It's important that you call ahead. We will be utilizing telemedicine when we can. Number one, to decrease the face-to-face time in the clinic, or number two, sometimes it's just a triage or nurse consultation. And if we can do that via telemedicine, instead of having you present at the clinic, that will be preferred. We will be instituting mobile self-check-in and texting to notify when a provider is ready. The whole intent of these new services is to keep the people congregating in our waiting room to a very minimum. So these new features will be explained as an appointment is made at the clinic. So just remember to always check your email for these important instructions. Again, we will only be seeing well visits inside the clinic. Again, we're located in the Mulva Family Fitness and Sports Center, so we do not want to be bringing in sick people to this building, and we will be caring for any patients with COVID-like symptoms or any upper respiratory-like symptoms in isolation. We will not be doing any of that testing or care inside our clinic. Well visits only. So, every day when you're on campus, you'll be expected to do daily temperature and symptom assessments. So, looking for the signs and symptoms of COVID and also taking your temperature every single day. It's important that you bring a clinical thermometer to campus with you as part of your supply. So, what do you do if you have symptoms? It's important to stay in or return to your room with a mask on. Again, do not present at the health center. It's important that you call health services during open business hours, and then our nurses will navigate what the next steps will be. If it's after hours and you notice you have a sore throat or a fever, it's important that you call the housing staff on call or campus safety, again after hours, and they will give you the instructions on how to pack essential items because you will be relocated to an isolation space for further evaluation. Testing is going to be conducted each morning, Monday through Saturday, for as long as testing supplies and personal protective equipment are available to SNC. If you'd rather not wait for health services to test, then you may coordinate testing in the area and return to the isolation space to wait for your results. If the results are positive, then isolation needs to continue, and that currently is 10 days from symptom onset and at least 72 hours after your fever and other symptoms have resolved. So you would need to stay in isolation if you're positive. It is recommended that you return home if it's safe to do so for that isolation. Home is the best place when you're not feeling well. If it is not safe for you to return home, let's say you have an elderly grandparent living with your mom and dad at home, then we do have isolation spaces here on campus. Quarantine, the same thing. Quarantine is if you are listed as a contact to a positive case. The first option is for you to return home if it is safe to do so. If it is not safe to do so or you can't return home, quarantine spaces will be made available on campus in those situations. So it's so important that you stay connected with health services so we can navigate those scenarios with you together. All the information kept at health services will and has to remain confidential. There are HIPAA standards and FERPA standards, those are federal laws that require that. A release of information must be filled out before staff can speak to anyone else. So that means your parents. Parents, this means you as well. So I know this is really difficult, and I have a student coming in as a freshman myself, and I cannot or will not access her health information without her consent either. And so because they are 18, they are an adult, and they will need to consent for us to talk to you. And so that needs to be documented in writing. So the nurses will be discussing that. There is a release of information for COVID navigation on campus only. That's the only release of information that we have posted currently on our website, on the Medigap portal, which is our secure health record, that students can fill out ahead of time in the event they become positive and have COVID, and we need to arrange services on campus because it's not safe for them to go home, let's say, for any reason. So that's the only time we pre-fill out a release of information is in this COVID world that we're all living in. You can find that release of information on our secure Medigap portal, which is available through our website. If you have any questions about that, you can call our clinic and we can navigate that with you together. So again, this is talking about that release of information to coordinate care for COVID and or any other respiratory illness. This is all pre-filled out, available on the Medigap portal, our secure health record portal, and we would only release information to coordinate services while staying on campus. So if we need to call dining services and let them know where you're staying in the Crest Inn so you can have food delivered, or if we need to coordinate with housekeeping, it's important that that release of information is filled out prior to you becoming ill, because the last thing you want to do when you're ill is fill out a whole bunch of forms. So take a look at that release of information. It's pre-filled out. It applies only to COVID and no other health condition, and it would only apply if you cannot go home and we would need to coordinate services while on campus. We do have a consent for services as well for minors, so all students who are under 18 will need a parent to sign a consent for services, a financial responsibility form, and a HIPAA privacy practice form. And so again, this only applies to students who will be under the age of 18. All of those forms are also found on the Medigap portal, which is our secure medical health record. And again, if you do have a student who is under 18, will be a minor, please call our office and we can navigate with you how to fill out that paperwork so we can serve them in your absence. So the 3 health requirements. The 3 health requirements for all incoming freshmen, this was pre-COVID. Every incoming freshman needs to have insurance policy information on file. Again, that is embedded in our Medigap portal and can be uploaded by students. So if you want to take that opportunity or if you have questions, all of the instructions are found right on our website. And we'll go through that in the next slide. Evidence of 2 MMRs. It's important that each student, this measles, mumps, rubella requirement has been a requirement for years. And so evidence of 2 measles, mumps, rubella vaccines is what has been on the requirement list for years and years. And so if you could enter those 2 dates into that secure Medigap portal, then you won't be getting reminders anymore from health services. Many of you have probably gotten emails and reminders if you haven't done the health insurance policy information or the 2 MMRs. Finally, the last requirement is just a basic health history. So just some basic questions. Have you ever had surgeries? Have you ever had, chicken pox? Just some of those basic health history questions, just so we can serve you well and get you connected to either our office or even counseling and psychological services before you get to campus. So 3 health requirements. So again, to access the Medacat portal, that's right on our website. You'll see that there on that slide. You go to New Students and you go to the Medacat portal and you just enter the first 4 letters of your last name and your first middle initials. That's always your username when you're on campus. And then the password that you created, for your SNC username and password. It's the same one that you log into everything on campus. So now tips on staying healthy and keeping the college healthy, right? I mean, we have extra responsibility this year to not only keep ourselves healthy, but we also have the additional responsibility of keeping the college healthy during COVID. It's important that you get your flu shot when it becomes available. Wearing your mask when outside your private living space. That is a requirement while you're on campus. Wash your hands frequently. So when you think you washed your hands enough, maybe just do it one more time. And because we not only, of course, have soap and water on campus, but we also have stocked hand sanitizer in every location to make it super convenient for you to be sure that you're practicing good hand hygiene. Wipe down commonly touched surfaces frequently. So as you enter a shared space, there will be cleaning supplies available. And when you leave the shared space, again, the importance of wiping down commonly touched surfaces is so important. And we all need to take that responsibility to do that. Practice physical distancing. It's really important that you keep your circle small for now. And I know that's contradicting to what you imagine college life to be. But it's very important that you do keep your circle small and practice that physical distancing. Remember, physical distancing is 6 feet away from other people. That's 2 arm lengths. Conduct those required daily self-health checks, and we talked about that. That includes not only your temperature screening that you're going to do in your residence hall every morning, but also just going through that list of symptoms. Do I have any of these symptoms today? And make sure that you do that every single day. Remember, if you are ill with any symptom, call health services during clinic open hours or call residential housing staff on call or campus safety outside of those clinic hours, and we'll give you directions and what to do next if that happens. Get your rest. It's so important that you sleep at least 8 hours a day. Getting your rest and your sleeping is going to protect your immune system. So it's very important that you are not sleep deprived. And there's going to be opportunities for you to get together, and do different things on campus, but please be mindful of the importance of sleep and rest for your body to stay healthy. Eat a balanced diet and drink lots of water. We have great food on campus and ample opportunity to eat a balanced diet. Again, that keeps you healthy, but it also keeps the campus healthy, because if you're healthy, the campus is healthy. So help your immune system by eating a balanced diet and drinking water. Finally, exercise. We have great trails in the area. The Fox River Trail is right here. Do go out and exercise, walk, run, use the fitness center. It's so important that you stay physically active, again, to support a healthy immune system. Most importantly, answer your phone calls. And I know in this world there's so much texting and social media, but it's so important to answer your phone calls, even if you don't recognize the number, because it might be one of our contact tracers reaching out to you, or one of our staff members as far as health services or counseling services, any one of our staff here at in Student Affairs reaching out to you. So please answer your phone calls, even if you don't recognize the number, and check your emails and respond to your emails each day. And that will help you stay healthy. It will help the college stay healthy. Everyone has a responsibility together to keep everyone healthy and safe. And really, that's it. So be well this summer. I'll see you in the fall.